Hello, I'm Dr. Seema Surana. I'm from Kolkata, and today we'll be talking about an important topic in pregnancy, that is recurrent pregnancy loss, which is a distressing condition for any pregnant woman. So pregnancy is an important condition as a pregnant mother holds and nurtures an unborn baby in her womb and waits for 9 months to hold it and see it. Unfortunately, some pregnancies last only for few months and are miscarried midway in the gestation. A miscarriage or a clinical loss of pregnancy happens more than twice, and that also before 20 weeks of pregnancy. We term that condition as recurrent pregnancy loss. Coming to the causes, that why does it happen? A pregnancy loss can happen due to a variety of reasons. The reasons can be genetic. It can be due to abnormalities in the uterus. Those are called anatomical abnormalities. Can be due to medical conditions in the mother, or it may be due to lifestyle or environmental conditions, and in some cases the causes are unknown or unexplained. Now coming to the most common cause, that is genetic. A recurrent pregnancy loss due to genetic condition is the most important cause of babies being miscarried so early. Now what happens is, because of the genetic abnormalities, the chromosomes in the embryo, the development of the embryo doesn't support the survival of the embryo in the uterus, and it is miscarried. Also, because of aging of the parents, the sperm or the egg may have effects of aging, and the babies can get miscarried early. Coming to the anatomical causes, an abnormal shape of the uterus, that can be a biconvex uterus or an arcuate uterus, can cause miscarriage. Also, sometimes a thick band of tissue called septate uterus, it is present in the middle of the uterus, and that makes the uterine cavity, which holds the uterus, very small, and so the baby is miscarried early. So coming to the other causes is medical cause. Medical abnormalities in the mother can be due to a variety of hormonal problems like polycystic ovarian syndrome, a diabetes mellitus, or a thyroid problem, or sometimes other autoimmune causes may be the reason behind the recurrent miscarriage. Lifestyle diseases. Now, obesity, smoking, increased caffeine consumption, or excessive alcohol use, and even recreational drugs, they can cause miscarriage recurrently in a pregnancy, and even they can cause many complications during pregnancy. After all these causes, most of the pregnancies which are being miscarried early are due to causes which are unknown to us. So it is very important to exclude other causes and treat accordingly. How do we know that it's a miscarriage? So the most common symptoms of miscarriage in early pregnancy are pain and bleeding. Other than pain and bleeding, some patients may not have any symptoms at all, and during the investigations we come to know that it's a miscarriage. So the common symptoms which we need to be aware of or teach our patients are spotting in early pregnancy. There are back pain which are more than the usual, menstrual cramps, painful contraction lasting for 5 to 20 minutes or more. Sometimes there are a history of passage of some tissues through the vagina during pregnancy, or the patients may complain of rapid decrease in the symptoms of pregnancy like nausea. Since so many causes can be the reason, and it is very important to make patient aware so that we can treat the condition. History is very important when a patient comes to us with such symptoms, because a past medical history can give us the reason, and it can be treated. Now, coming to how do we go about the investigations and treatment of RPL. Since RPL is a treatable condition, it is important to find out the cause and treat accordingly. A past medical history is very important, and also a thorough investigations, which includes history investigations, which includes imaging as well as blood test. The imaging which we do to find out the causes inside the uterus are HSG, transvaginal sonography, hysteroscopy, or endometrial biopsy. The sonography helps us to delineate the abnormalities inside the cavity of the uterus. That can be a polyp or a septum in the uterus, or a fibroid, that is a growth in the uterus. And hysteroscopy is an imaging procedure. It's where we insert a camera inside the uterus, and simultaneously a biopsy can be taken if we find any growth or previous scar or any synechiae, that is due to previous surgeries. Now coming to the blood investigations, The common blood investigations to find out are antiphospholipid antibodies. Antiphospholipid antibodies include two common antibodies like lupus anticoagulant and anticardiolipin antibodies, and they are done to find out the cause of recurrent miscarriage in a woman, and since treatment is possible for this condition. The other is a hormonal test which include thyroid profile, which tells us about hypo or hyperthyroidism in a mother, which can be a cause, as well as the other hormones like AMH, anti-Mullerian hormone, or FSH, which tells us about the number as well as quality of eggs in the mother. The other test which we can do are thrombophilia test, which tells us about the clotting disorders in the family, or ANA, that is anti-nuclear antibody test. And also we can do other tests like genetic test called karyotyping. Here we test both the parents for the genetic abnormality in the chromosome which were responsible for the miscarriage in the fetus. So having a healthy baby following recurrent miscarriage is possible if we find out the cause and treat accordingly. But it is very important to do all the tests which I mentioned, because sometimes multiple causes are responsible for the miscarriage. Thank you.